Hi there. Welcome to your doctor's report. We are so thankful that you've chosen Scholes Family Chiropractic. I just want to share a brief history with you. Dr. Andy and I met in chiropractic school during our first year of school. We actually graduated in 2002. We got married in 2002, and we opened this practice in Carnes in 2002. So we had a really busy year. In 2007, our son Zach was born. We love serving this community. We love seeing people live healthier, pain-free lives. And we're so excited that we get to do that every single day.
Hi, I'm Dr. Andy Scholes. Welcome to your doctor's report. We're so excited that you're starting chiropractic care. The word doctor actually means teacher, so we really believe firmly in teaching our practice members how their bodies work, how health works, and how chiropractic can work to help make you be healthier. I want to start off with just a quick testimonial that we have from one of our patients named Jenna. She says, I started coming to Scholes Family Chiropractic because I was unable to walk, move, or sleep due to sciatica pain. If you've never had sciatica, that is pain down the back of your leg. It can be excruciating. She said her sciatica was so bad when I was pregnant, I could barely walk into the hospital to give birth to my daughter. After being under chiropractic care, I can now walk 2 to 4 miles a day and carry my child, squat down, even while holding her, climb stairs, and do all the things I physically was able to do prior to pregnancy. I would tell others that Scholes does an evaluation first, does a great job with patient education, and makes that a part of their treatment, which I believe we should see more of in the medical field, and taking the time to explain why. So that's what we're wanting to do today, is take the time to explain the why. Hippocrates actually said, look well to the spine for the cause of all disease. And he really knew what he was talking about. Most people come into our office thinking that if they have a pinched nerve that they may have pain in their neck or pain in their back, wherever that pinched nerve may be. But in reality, if we take a cross section of your spine, only 3% of all of the nerves passing through your spine are pain sensitive. That means the other 97% are doing other things. 45% of your nerves are motor nerves. They're the ones that move you around. They move your muscles. So if those get pinched, you can have weakness, spasms, fatigue, tightness. Another 45% are your autonomic nerves. These are the most important ones because they're going to all your cells, tissues, organs, blood vessels. And then you do have some sensory nerves. 3% of those feel pain. Those are the ones that tell you, hey, something's going on. But you have others that detect things like touch, temperature, blood pressure, posture. So there's a whole lot of information going through your spine that isn't necessarily pain related. Think of your spine like an information superhighway. Think of it like Interstate 40. If all lanes are open, your brain is communicating with your body and everything is working the way that it should. Unfortunately, sometimes with your spine, just like the interstate, sometimes there are blockages, right? Your spine can move out of alignment. We call these vertebral subluxations. Your vertebrae start putting pressure on these nerves. It doesn't take much pressure either. In fact, research shows that the weight of a dime pressing on one of your spinal nerves is enough to cut off 60% of that nerve's communication. The weight of a quarter can cut off 100% of that nerve's communication. So then, wherever that nerve's going, if it's one of these muscle nerves, that muscle is going to be weak. If it's going to, let's say, your heart's not going to function the way that it should. If it's going to your digestive system, that's not going to work the way that it should. So we're always looking above and beyond just where those aches and pains are and trying to make sure that your spine and your body are functioning as well as possible. So if we take a look at a few of the bones in your spine, some of the more common ones that we see out of place on a daily basis, right up here at the very top, that's your C1 vertebrae or atlas vertebrae. When that gets out of alignment, that can cause problems from the top of your head all the way down through your large intestines, including all the organs in between. Super important bone when it comes to your overall health. C2 and C3, they're the next two down below C1. They are what we call the headache bones. A lot of times when those get out of place, it puts pressure on your brainstem and spinal cord. It can cause headaches, tension headaches, migraine headaches. Then dropping down between your shoulder blades, this area right up here, a lot of people have tension and pain up in there. Those are your cardiopulmonary nerves. They go to your heart, to your lungs, and down your arms. Those, when there's pressure there, can lead to high blood pressure, low blood pressure, rapid heart rate, decreased heart rate, depending on if it's being pinched and excited or pinched and cut off. And then finally down in the low back is another really common area. Definitely can cause low back pain, can cause pain shooting down the legs, which is called sciatica. Also, though, these nerves coming out of your low back, they go to your digestive system. So we see a lot of people with irritable bowel syndrome, digestive issues down when these low back problems are there. Also reproductive issues in both men and women. So in a few minutes, we're going to go back and look at your x-rays if we took x-rays on you. And you're going to notice a few things. When we look at you from the back or the front, if you're looking at somebody, pretty much everybody knows you should be straight, right? We don't want to see you curving off to one side or the other or twisting one way or the other. But what a lot of people don't realize, when we look at you from the side, there are some curves that are supposed to be there. There's one in your neck, one in your mid-back, and one down here in your low back. These are your natural God-given shock absorbers. They're there for a reason. Every time you take a step, there's shock on your spine, right? Your spine acts like a spring. If you were to like stumble off of a curb like I've done before, or a step, or let's say you have a car accident or a sports injury, there's going to be a lot of shock on your spine. So these springs are there to help protect you. The problem is most of us spend a good part of our day looking down, so we lose this curve here in our neck. And if we spend a good part of our day seated, we lose the curve in our low backs. So instead of dropping the ball onto a spring, next time we have shock and trauma to our spine, it's more like dropping it down onto a cement block. There's no natural shock absorption, so the discs in between your bones, these little areas, they take up the brunt of the force and they start to wear out. That's where it can lead to disc degeneration, or what you may have heard of as degenerative joint disease, degenerative disc disease. What that means is the discs are getting more and more narrow over time. So these two x-rays are both necks facing this direction. So you're looking at them like this. This one is normal. You're supposed to have a nice curve to it, about 40 to 60 degrees. These darker areas are the discs in between the bones. That's how they should look. This one over here, this person has lost their normal neck curve. And so the discs have started to degenerate. And over time, what will happen is the bones start rubbing on one another and more calcium gets deposited in that area, leads to bone spurs. So we definitely don't want that to happen if it hasn't already. If it has, we want to stop that process and try to reverse it as much as possible. Now, an easy and fun way for you to think about keeping that curve in your neck is to think of it being like a banana. What happens if you straighten out a banana? Well, it's not going to be very good, right? It's going to squish these outer fibers and it's going to pull these apart in here. So if you think of your spine being like the curve in a banana, every time you straighten it out, you're compressing the discs and you are pulling the spine. So we don't want to do that. We want to try to keep our head back over our shoulders. And we'll talk more about that in the next video as far as posture and exercises. But I want to get into some of the things that actually cause subluxation in the first place. Every time we take somebody back to look at their x-rays and they have some issues, they ask us, well, how did I end up that way? Well, I'm going to tell you how you probably ended up that way. We never know for sure unless you came in maybe right after a car accident or something like that. But usually it's an accumulation of stress on your spine throughout your life. And stress can come in three separate forms. Psychological stress or emotional stress, these are things that stress you out emotionally. Maybe, getting angry, being mad at somebody, being scared, frightened, sad. All these different stresses take effects on your body. So think about driving in really bad traffic in the fog. What happens to these muscles up here? I know in me, I get, really tight, right? And so those muscles get tight. It affects the nerves going out to the heart and lungs. Heart rate accelerates. You maybe get sweaty and things like that. It pulls the spine out of alignment. So the more relaxed you can be emotionally, the better off your spine's going to be. Chemical and biological stresses. These are a little bit more tangible things you can try to avoid. Things like smoking. There have been research studies that show that smokers, the nerves coming to their lungs or back from their lungs through the spine actually cause the spine to twist out of alignment. Medications, drugs, those are going to affect the nerves coming into your spine from your kidneys and your liver. Alcohol is going to affect the ones from your liver. Air pollution, again, kind of like smoking, is going to affect the nerves from your lungs. Air pollution is pretty hard to get away from, though, right? Here in East Tennessee, we actually have pretty poor air quality. We're stuck between the Cumberland Mountains and the Smoky Mountains, and everything collects down here in the valley. One of the really cool things about your body, though, is it's very adaptable. One of your central nervous system's main jobs, your central nervous system being your brain and your spinal cord, one of its main jobs is to analyze what's going on in your body and then constantly adapt to that. It's called keeping your body in homeostasis. That's a really important term because without that, you're going to be dead very quickly. Your body has to adapt to its surroundings all the time, whether it be air pollution, water pollution. Now, I don't think any of us are drinking brown sewer water, right? But even city water has over 350 chemicals that we have to be able to deal with. And then we've got our foods that we eat have chemicals in them more and more every day, it seems like, preservatives, stuff like that. We've got viruses out there, bacteria, molds, fungi. These things are in the air right now. They're in this room. But our central nervous systems help coordinate an attack. When these things get into our body, they coordinate our immune systems to attack these viruses, these bacteria, and destroy them before they can make us sick. Or even if they do make us sick, we want it to be as minimal as possible. Doesn't matter if it's a flu virus, a coronavirus, some kind of a bacteria. We want your body to be able to fend that off as well as it can. One of the really cool things that our practice members tell us that have been coming in for quite a while, they say, you know what? I don't get sick nearly as often as I used to. And I can say that's definitely true for myself. Now, that's not something you're probably going to notice in the first couple months of care, but after 6, 12 months of care, yeah, you're going to probably notice it too. A faster, more powerful immune response. Other ways to get subluxated are going to be through physical stresses. We all had a big physical stress when we were first born. Somebody most likely grabbed you by the head and they start pulling and twisting and turning and putting a lot of pressure on your neck. So that's why we check babies right from the beginning. Our son, he was born at home. I was able to check him within the first 5 minutes of him being born and adjust this top bone in his neck. It just needed a little tweaking to get back into place. Very, very light adjustment for him. And then as we go throughout life, we do things to mess up our spine. I just have a few examples here. You know, you can probably think of thousands of things that you could do to injure your spine. So if you think of it as being an accumulation of all the traumatic events, stressful events on your spine throughout your life, that's how you ended up where your spine is today. Other causes can be like work-related things, sleeping in the wrong position. We'll get more into that on the second video as well. Accidents, improper lifting as far as weightlifters working out. Activities that we enjoy even can cause our spine to move out of place, especially those one-sided activities like golf, bowling, tennis, things where you're using muscles more on one side than the other. So when people come into our office, again, most of the time they do have pain, but pain's just the tip of the iceberg, right? We already know that only 3% of the nerves feel pain. So what's going on down here? Well, this is that whole accumulation of your life of stress since you were born. And that's the under part of the iceberg, the part that we can't always see. These are the ones we can feel. Down here are the ones that have been there for a long time and we don't necessarily feel. So we don't want to just ignore these though and treat these. If we do that, what's going to happen is it sends us on this downward spiral. A lot of times people will take medications, maybe Tylenol, something like that, try to mask the symptoms with over-the-counter pain relievers. Those stop working after a while, headaches come back, the neck pain comes back, so they go on this downward spiral, taking stronger medications, maybe even shots or surgery. What we want to do is find the cause, eliminate that, get rid of that over time, and then the tip of the iceberg is going to be gone. But guess what? It takes a long time to build a big iceberg, right? It's going to take quite a while to melt that iceberg, to shrink it down too. So it does take time. It takes repetition with chiropractic care. It's a lot like wearing braces on your teeth. On average, a person that goes to an orthodontist and gets braces, they have to wear those for 2 to 4 years. I've heard as long as 8 to 10 years for some people. And that's to move the teeth just a few millimeters, about that much right there. Sometimes the spine's out of place a couple inches. I've never seen anybody with that big of a gap in their teeth, right? That'd be clear across your whole mouth. It's going to take time to get that back where it needs to be. So let's say you did go into the orthodontist and were prescribed braces, you put those on, and you took your braces off. You're supposed to wear them for 4 years. You took them off after 2. Well, your teeth are going to move right back out of alignment. Same's true with the spine. If you follow your adjustment schedule, things start to line up. But if we discontinue care too soon, the spine moves right back out of alignment. So we always recommend complete corrective care for our practice members, and then we follow that up with wellness care to keep things where they're supposed to be. Now, sometimes people may come in to me and they ask, maybe their spine's curving like this, and they'll be like, well, doc, can you just take a baseball bat and whack me a few times and knock that thing back into place? No, you wouldn't like me too much if I did that. So what we need to do instead are more gentle adjustments over a longer period of time with lots of repetition. Another question I'll get sometimes is somebody will say, well, could I just come in like every day of the week and do that for a month and then I'll be all set and never need to get adjusted again? Yeah, you'd probably feel a lot better if you did that, but the problem is it'd be like going home and brushing your teeth for 3 straight hours. You're going to have really clean teeth, but what are you going to have to do again tomorrow and the day after that and the day after that? You're going to have to brush them again, right, to keep them clean. Same's true with the spine. We constantly have gravity pulling on us. Those stresses I talked about earlier are pulling things out of alignment, so we have to keep up with those adjustments to keep things lined up the way that they're supposed to be. Now, Albert Einstein said you cannot resolve a problem with the same level of thinking that existed when the problem was created. We look at things a little bit differently. We're not medical doctors, so we're not going to prescribe medications from outside in to alter your blood chemistry or try to mask the symptoms. We're looking at you from the inside out. We're trying to find the cause of the problem, correct that so you can heal from inside out. We're not physical therapists, we're not massage therapists or nutritional therapists. There's a time and a place for those things. If you need that, we can definitely refer you to somebody that can work with us and get you really good care with that. But what we are chiropractors. We're looking for the subluxation in your spine, and we're looking to correct that, get that pressure off of there. So that's what we do, is the chiropractic adjustment. Typically, we do that with our hands. It's a very gentle adjustment, moving that back into place. Sometimes we may use a drop table to adjust these big bones down here in the pelvis. Sometimes we may use an instrument. This one's called an activator, has a spring inside there, helps us adjust those bones back to where they need to be as well. So kind of communicate with us what you're more comfortable with possibly. We always want to do what's best for you, but you can communicate with us. Some people are more comfortable with one type of an adjustment versus another. Another thing that we do differently in our office is we always want to respect your time. I know our time is valuable. I know your time is very valuable. And so we try to make it so that when you come in for an adjustment, you're only here for about 10 to 15 minutes maximum. There'll be a few times where we do evaluations, things like that, where it may be a little bit longer, but we'll always warn you ahead of time for those. So getting into conclusion, if you think about taking care of your spine, it's like taking care of anything else. If you want to maintain the roof on your house so that it lasts a long time, if you want to maintain your car so it lasts a long time, you have to do that properly, right? This is a 1973 Mustang, not in very good shape. This is also a 1973 Mustang, been taken a lot better care of. So I think this first one, the owner of it's not going to get much enjoyment out of it. They're not going to get to use it, right? And with this car, they're going to get to use it. So with a car, it's pretty easy to replace parts. We can replace the whole car if we need to. With our spines, we don't want to have surgery, right? And there's no such thing as a spinal replacement surgery, and I don't think there will be in any of our lifetimes. So we need to take really good care of it so we can enjoy it and can use it for the rest of our lives. Last time I was in Florida along the beach, I saw an elderly couple playing with their grandkids, and they were just having a really good time. And I thought, I want to be like that someday when I'm that age, if I have grandkids. I want to be able to run, keep up with them. I want to be able to do the things I enjoy. So think about it. What are the things you enjoy? What are the things you want to be able to enjoy 20, 40 years from now? For some people, it might be golf. Maybe community service projects, helping people out doing things through churches, little league teams, stuff like that. My family, this is my wife Jennifer and our son Zachary. We like to camp. We like to travel a lot. That's a picture of us up in Michigan at Mackinac Island. We like to play pickleball. We like to water ski. So active things. We like to hike and get out there. And some of these things may be the things you enjoy also. So one of the really cool things about chiropractic is that it not only adds years to your life, more importantly, it adds life to those years. So we can get out there and do those things that we love and enjoy, be with our families, our friends, and serve.
Wasn't that amazing information? We hope that you can tell how passionate we are about what we do in this office and the ability to be able to help people live healthier, pain-free lives. We like to give people hope that their body can heal on its own. In fact, our motto in our office is that we move the bone, God does the healing. We don't heal anybody of anything. We make sure that the brain can talk to the body properly so that your body can heal the way that God designed it to. So we love giving people that hope. And Patty here, this is a great example of that. In 2016, I began to have constant pain. I had sciatica, pain in my arms and neck, headaches, TMJ, and even low back pain. To get relief, I used pain medicine and anti-inflammatories. After about a month of chiropractic care, I felt so much better. I have not had a headache since I started. My pain for the most part is gone, and I can turn my neck and pick up my grandkids. I haven't had to use medicine or anti-inflammatory drugs since starting care. She has improved her quality of life tremendously. She's able to spend time with her grandkids. She's not putting toxic medication into her body anymore. We want to give people that hope, and I hope that you will help us spread that message. So please tell your friends and family, tell them about chiropractic. Most people have never even thought about what their spine and what their nervous system does to their body, and how, when it's functioning properly, your body is going to heal on its own. So this is the first of a two-part series. The second video will be in a couple weeks. Dr. Andy will talk more about things you can be doing at home and at work so that you're improving faster, so that you're able to hold your adjustments longer. So some stretches, exercises, some postural changes, sleeping positions, things like that that you can do on a practical basis to make sure that you're getting better as quickly as possible. So again, we thank you so much for choosing our office.